I'm delighted to be with you to share some reflections about global, regional, and national governance, what we saw from the COVID-19 pandemic in terms of failure. But let me also say from the very beginning, it was not just failure that we experienced across the world. We saw a lot of hard work, and we saw also a lot of success, very much historically compared to what we've seen in the past. What I'm going to share, and what you also heard from some other speakers during this meeting, what something called the Independent Panel on Pandemic Preparedness and Response found. This was an independent high-level panel that worked during 2002. I had the privilege of being the head of the secretariat, and a lot of the lessons that not I'm just going to refer to now, but that many people are referring to, came out of this work. So this was a systematic review of what we can learn from the outbreak of the pandemic after the first 9 months. So just to share with you a couple of the high-level big picture lessons. The first one, when it comes to how the international system worked and how national government worked, and also how the interactions took place in between national government, regional structures, and the international system, was that despite warnings and clear lessons learned from the past, the world was not prepared. There have been a number of reports and commissions presented telling the world that this was going to happen, but also with clear recommendations in terms of what needs to be changed, and still the world had not taken action. So that was one of the first lessons, that the world has not taken note and learned from the past. The second one, when it comes to the international system and the interaction again in between national, regional, and global structures and governance, was that the reaction, the speed in terms of how things happen, was too slow. Not necessarily the very first initial reaction that came then from the government of China during the very first days when the first cases were found in Wuhan. That was actually quite okay when it came to time, slight delays. A larger, a more substantive delay happened in January when the International Emergency Committee was going to advise the Director General of WHO whether to declare a public health emergency of international concern or not. Then there was a clear delay. So that was basically the whole month of January that was lost before that message came to the world. But the big delay was basically then during the month of February, meaning that very few countries actually reacted when the Director General of WHO said, we have a big problem here. So the alarm system, the international governance in terms of them being providing direction to the world, did not work well enough. And that was part also of the conclusions, recommendations, what needs to be done now for the future. If we look then more specifically at the national level, again, drawing on the work that was done by the independent panel, we did 28 country studies, not in order to rate or to rank countries, but to learn from the 7 best cases and the 7 worst cases. And then we had 16 countries in the middle here. What could we find in terms of main sort of conclusions? If we look specifically then around governance and leadership, the low-performing countries, and I think I can name them here, the US, the Brazils, and countries like that, that initially had a very inefficient, ineffective response. There were some common themes here in terms of governance. First, I mean, the whole situation was devaluated, was regarded that non-existing, even denial. There was a lack of coordination in between different levels of the government. There was a refusal to take this serious and to take actions. There were delays, and there were also politicization of the situation. So this became even party politics in some countries rather than treating this as a public health emergency. On the contrary, some of the high-performing countries, and here you had some of the countries in Southeast Asia or in like South Korea, Singapore, Thailand, you saw some very effective response. There was an engagement of partners in the countries, was cross-government work, there was good coordination, it was not only the Minister of Health, but also other relevant ministers. There was an approach to develop and to strengthen tools, whether it was to provide financial support or to refine the policies that were in place. So there were some good practices and there were some bad practices when it comes to governance at the country level. Moving then to the regional level, I think the most striking lessons here from the pandemic, from the COVID-19 pandemic, what was happening in the European Union and in the African Union, and also the interaction in between those two regions. Of course, what was in the focus of this was access to vaccines. What was interesting here was the different approaches and what happened over time when it came to the political commitment and also in terms of taking responsibility, which is part of governance there. The European Union were very ambitious very early to ensure that they would basically safeguard access to the vaccines through entering into contracts with all existing or known potential vaccine producers. And they did not only enter into contracts for the total population of the European Union, but 5 times as much vaccines as was actually going to be needed for that part of the world. And the US and Canada and a couple of other countries did the same, taking no risks. The implication of that was, of course, that the possibilities for other countries, including also for the global mechanism COVAX, to enter into contracts at competitive prices were quite limited because already all the space was taken by the European Union and others. But what happened here over time was very interesting to see how both the African Union then were really strengthening the African CDC, but also the political will and governance from the African side saying, this is not acceptable. We will raise our own resources. We will set up our own vaccine platform. We will ensure that we are actually getting the vaccines also to our populations. We will not only depend on the willingness from some other countries to donate a bit of vaccine to us. There was a very interesting dynamic here in between different regional bodies. And I think for the future, this is important that we will have stronger regional bodies when we are going to see how we can get and how we can strengthen the international system also to be ready for the future. But interesting dynamics both within and in between those regions. Global governance. If we look at the global level, then of course, I think we all remember at the very beginning the quite difficult conversation in between the US and China. This basically meant that the world could not come to, in some way, strong and responsible leadership to see how one would manage this outbreak. US blaming China for not being transparent and not sharing information, and China, of course, not being very happy with this. And also, I think we still remember President Trump, how he came out very clearly to say that I don't believe in WHO, we are basically going to leave that organization. All of this has to do with generating mistrust, which was not the best thing to do when we had a global crisis. So we saw that at the very beginning, and we did not have a good platform for how and where to make sure that we can get good political governance and responsibility at the global level. And this continued when there were discussions in the Security Council in the US, in the United Nations. One couldn't come to an agreement in terms of one of the security resolutions because of the mentioning of WHO. US refused to actually refer to WHO, which is, looking back, it sounds totally unbelievable. But that was the case. So there was not really a platform where you could have global political negotiations and discussions. G7 at that time, then chaired by Germany, now lately by Japan, and the G7 at that time by Indonesia and now by India, are important platforms, but they are not formal governance bodies. They are informal constellations of countries, very important and can be very useful, but also both the G7 and more importantly, the G20 have not been able now to come to very firm and concrete decisions, partly because if you think about the G20 and the political dynamics with Russia, China, the US, and some of the other countries. So a very difficult political environment. So the global governance or the governance at the global level have definitely not worked in a perfect way. We see that also now in Geneva, when the negotiations have started on a new global treaty, a new set of global rules for how we're going to be more safe in the future. Those negotiations should be ready May next year. They have basically not started. There's a lot of discussions, preparatory work, but real negotiations and being close to actually having the new legal instrument in place, there's a long way, and there are big tensions in between different groupings and in between different countries. Now, in New York, there are 3 high-level meetings that have just happened on tuberculosis, on universal health coverage, and on pandemic preparedness and response. Again, the independent panel made some very clear recommendations here in terms of make sure we have a new legal framework, make sure we got more financial resources, a stronger WHO, a new platform for having access to vaccines, but also an independent governance and monitoring of how the international system is performing. Will the world have taken decisions on those now at this high-level meeting, the opportunity now that countries have coming together and take those decisions? No, unfortunately not. The world, as the panel was saying in their report 1 year after their initial report, is the world really transforming, or is the world still tinkering? And the answer is very unfortunate. The world is still tinkering. So we still have big challenges here in terms of all governments across the world taking responsibility. So in the nutshell, unfortunately today, there is more failure than success. Do we need then to be totally pessimistic about the future? I hope not. And we'll finish just with one slide looking back, remembering that it is actually possible to tackle also big challenges and the big emergencies. And if you look at the United Nations, looking back now 22 years, we established the Global Fund. We had a special session of the United Nations in the year 2000, where the world agreed on a set of indicators and targets for what to do about the HIV/AIDS situation at that time. Those indicators, that agenda, meant a lot for the world, as well as the establishment of the Global Fund in the year 2002. This is now Kofi Annan, who was the patron, Christos Kionga, who was the first chair, and I was the interim executive director for the secretariat at that time. Looking back and looking at the actual results, I still feel optimistic that yes, we have a difficult political situation today, both in many countries, national level, in regions, and at the global level. But if we look back to see that, yes, we could tackle and manage a big challenge at that time, and I'm sure we will be able to do that again. Thank you.